Hi everyone, and welcome to TS Fibro. Number 5 on our introduction to fibromyalgia is rebound pain. What is rebound pain with fibromyalgia? When fibromyalgia patients are feeling a lot better, their pain is lessened, they're not so sore, their first instinct may be to jump up and get things done. They may clean the house, meet friends for lunch, then go for a hike in the afternoon with the kids. While these things are all wonderful things to do, the result of this increased activity can be even worse pain later that night or the next day. So the rebound pain that you're going to get from fibromyalgia, when you feel better and you get that instinct to get up and just get things done because they've gotten so far behind, and you do too much, then the pain is a lot worse than it started out to be. So you need to pace yourself and not do too much at once. Take breaks in between. If you're cleaning house, clean for a little bit. Your body will tell you when you need a break. Take a break. If you take a hike with your family, don't go too far. Don't do too much. Take a break when you need it. You'll know. So rebound pain for fibromyalgia is just that. You do too much. You don't know your own limitations, and you push yourself like we all want to when we feel well. Then the rebound pain comes, and it's a lot worse, and you'll go down. There's also a rebound pain caused by medication. And medication are supposed to help, not hurt, right? Unfortunately, some commonly used drugs can cause pain, even the ones available without a prescription. Some cause headaches, others cause foot pain, others, whatever their pain is. A medication could be the root of it. So, 2 of the top 5 medications that cause pain are available over the counter, without a prescription, without physician guidance. You might be unaware that your pain could be related to these medications that are under your control. Caffeine-containing medications, including Excedrin, Midol, Anacin. If you were experiencing headaches and you are also using caffeine-containing medication more than 2 or 3 times per week, your headaches might be caused by the over-the-counter medications. These drugs can cause rebound headaches because the brain screams for more when the effects of the drug wears off. So what once was an episode of headaches as a young person could result in a lifetime of headaches because of routine use for products. Limit your use of medications and talk to your doctor if you're experiencing headaches, and regularly use over-the-counter medications. Non-steroid anti-inflammatory medications like ibuprofen, Advil, Aleve, these over-the-counter anti-inflammatory medications can also cause pain, usually in the form of stomach pain. Again, because these drugs are available without a prescription, you are in charge. If you use these medications routinely and or at high doses, you could be at risk for not only stomach pain, but also a life-threatening stomach bleed. Please talk with your doctor if you're using any of these anti-inflammatories. Please talk to your doctor. And also, if you're experiencing stomach pain or upset tummy and you're using these medications, please talk to your doctor, because you don't know if it's something more serious. The next 3 medications that can cause pain are only available with a prescription, but that does not necessarily mean that your doctor would realize that your pain could be related to these drugs. Chemotherapy drugs. Many doctors who prescribe chemotherapy are well aware that these drugs can cause nerve damage in the form of neuropathy. In fact, the onset of neuropathy can be primarily limiting factor for the amount of durations for the chemotherapy. The chemotherapy can be life-saving, but a painful neuropathy is not easy to live with. The best thing to do is to prevent the neuropathy from occurring is in the first place by taking the acetyl carotene, which can protect your nerves while using these toxic drugs. Once you have a painful neuropathy, the nerve pain is treated with a variety of different drugs, which can have their own onsets of unwanted side effects. Cholesterol-lowering drugs. Thousands of people take medications to lower their cholesterol. A portion of these people will also live a life with chronic pain as a result of the medications. Muscle pain and weakness is well known to be a resulting side effect from cholesterol-lowering drugs, but can easily be mistaken for other things like fibromyalgia without anyone realizing that a drug is causing the pain. If you have recently begun using one of these medications in the past year or two and have suddenly started to feel pain, talk with your doctor about the possibility of these medications being the root cause of your pain. Again, opioids, hydrocodone, hydromorphone, oxycodone, morphine. Yes, the drugs used to treat pain can also cause pain. If you've been using opioid drugs for years, the pain keeps getting worse and worse. This vicious cycle could be a result of the opioid-induced hyperglycemia, because the opioids turn your natural pain-relieving system off. Your body is left without enough chemicals in the system as the drug wears off every 4 to 6 hours. This cycle causes a frequent roller coaster of up and downs that can sensitize the nervous system to the point that you feel more pain. Not only do you feel more pain, you feel anxious, restless, and have trouble sleeping. If this sounds familiar, then it is time to find an exit strategy off opioid roller coaster that you are on. All these commonly used drugs can take people on a bad ride with chronic pain. Being aware of the danger that some of the medications you are using might also be causing your pain is an important step towards potentially getting off that ride. You don't want to be the last one to know that your drugs can be causing your pain, and that is the rebound pain. Okay, so that's rebound pain. As far as the fibro rebound pain, well, we all know our limitations. Well, we know our limitations, but we don't always follow them. Because when you're down, when you have a flare and you've been down for a few days, a week, a month, everything backs up, everything gets behind. So when you feel good, you get up and you try real hard because your brain's saying, let's go, we can get this done. Your body feels better. So you get up and you push yourself, and then you pay for it later, which is the rebound pain. On the medication, I would really consult your doctor if you feel like you're having rebound pain from your medication. Speak to your doctor and see if there's an alternative that you could switch to, another medication that is less likely to give rebound pain. Some people have more of rebound pain than others, but always consult your doctor for whatever reason. Don't just automatically assume anything, because that's when people with fibromyalgia get in trouble, when they assume, well, this pain is from fibromyalgia. So that's our rebound pain. Hope you enjoyed the video. If you do, please subscribe, like, and hit the notification bell so you'll be informed on any new videos that I drop. I pray for a cure, and I pray that you have a pain-free day. God bless.